Hello and welcome to another episode of GI Talk. In this episode, we want to talk about one of the most common GI symptoms, diarrhea. We will talk about its definition, symptoms, causes, and treatments for diarrhea. Diarrhea is loose, watery stools 3 or more times a day. Diarrhea may be acute, persistent, or chronic. Acute diarrhea is a common problem that typically lasts 1 or 2 days and goes away on its own. Persistent diarrhea lasts longer than 2 weeks and less than 4 weeks. Chronic diarrhea lasts at least 4 weeks. Chronic diarrhea symptoms may be continual or may come and go. Signs and symptoms associated with diarrhea may include abdominal cramps or pain, bloating, nausea, vomiting, fever, blood in the stool, mucus in the stool, urgent need to have a bowel movement. It is important to see a doctor if you have any of the following symptoms. Your diarrhea persists beyond 2 days with no improvement. You become dehydrated. You have severe abdominal or rectal pain. You have bloody or black stools. You have a fever above 102. In children, particularly young children, diarrhea can quickly lead to dehydration. Call your doctor if your child's diarrhea doesn't improve within 24 hours or if your child becomes dehydrated, has a fever above 102, has bloody or black stools. Diarrhea can be caused by various reasons. Let's take a look at some of the common causes together. One of the most common causes is viruses. Multiple viruses, such as norovirus, adenoviruses, astrovirus, cytomegalovirus, and viral hepatitis, can cause diarrhea. Rotavirus is a common cause of acute childhood diarrhea. The virus that causes COVID-19 has also been associated with gastrointestinal symptoms, including nausea, vomiting, and diarrhea. Another cause can be bacteria and parasites. Exposure to pathogenic bacteria, such as E. coli or parasites through contaminated food or water, leads to diarrhea. When traveling in developing countries, diarrhea caused by bacteria and parasites is often called traveler's diarrhea. C. difficile is another type of bacterium that causes diarrhea, and it can occur after a course of antibiotics or during a hospitalization. Medications are also a common cause of diarrhea. Many medications, such as antibiotics, can cause diarrhea. Antibiotics alleviate infections by killing bad bacteria, but they also kill good bacteria. This disturbs the natural balance of bacteria in your intestines, leading to diarrhea or a superimposed infection, such as C. diff. Other drugs that cause diarrhea are anti-cancer drugs and antacids with magnesium. Lactose intolerance is another cause of diarrhea. Lactose is a sugar found in milk and other dairy products. Lactose intolerance can increase with age because levels of the enzyme that helps digest lactose drop as you get older. Fructose intolerance can cause diarrhea as well. Fructose is a sugar found naturally in fruits and honey. It's sometimes added as a sweetener to certain beverages. Fructose can lead to diarrhea in people who have trouble digesting it. Artificial sweeteners is another common cause of diarrhea. Sorbitol, erythritol, and mannitol are artificial sweeteners that are non-absorbable sugars found in chewing gum and other sugar-free products. They can cause diarrhea in some otherwise healthy people. Previous GI surgery. Partial intestine or gallbladder removal surgeries can sometimes cause diarrhea. Other digestive disorders. Chronic diarrhea has a number of other causes, such as IBS, Crohn's disease, ulcerative colitis, celiac disease, microscopic colitis, and small intestinal bacterial overgrowth, SIBO. Your doctor will ask about your medical history, review the medications you take, conduct a physical exam, and may order tests to determine what's causing your diarrhea. Possible tests include blood test to look for any abnormalities, stool test. Your doctor might recommend a stool test to see if a bacterium or parasite is causing your diarrhea. Hydrogen breath test. This type of test can help your doctor determine if you have a lactose intolerance. After you drink a liquid that contains high levels of lactose, your doctor measures the amount of hydrogen in your breath at regular intervals. Breathing out too much hydrogen indicates that you aren't fully digesting and absorbing lactose. Flexible sigmoidoscopy or colonoscopy. Upper endoscopy or EGD. Most cases of acute diarrhea clear on their own within a couple of days without treatment. If you tried lifestyle changes and home remedies for diarrhea without success, your doctor might recommend medications or other treatments. Treatment of diarrhea depends on the cause of your diarrhea. Some of the common treatments are antibiotics or antiparasitics. Antibiotics or antiparasitic medications might help treat diarrhea caused by bacteria or parasites. If a virus is causing your diarrhea, antibiotics won't help. Treatment to replace fluids. Your doctor likely will advise you to replace the fluids and salts. For most adults, that means drinking water with electrolytes, juice, or broth. If drinking liquids upsets your stomach or causes vomiting, your doctor might recommend getting Grumman for fluids. Water is a good way to replace fluids, but it doesn't contain the salts and electrolytes that are essential for your body to function. You can help maintain your electrolyte levels by drinking fruit juices for potassium or eating soups for sodium. But certain fruit juices, such as apple juice, might make diarrhea worse. Probiotics or brat diet consisting of banana, rice, applesauce, and toast may help improve your symptoms as well. Adjusting medications you're taking. If your doctor determines that an antibiotic caused your diarrhea, he or she might lower your dose or switch to another medication. Treating underlying conditions is the most important step of treating chronic diarrhea. If your diarrhea is caused by a more serious condition, such as inflammatory bowel disease, your doctor will work to control that condition. You might be referred to a specialist, such as a gastroenterologist, who can help devise a treatment plan for you. Please keep in mind that regardless of the cause of your diarrhea, the most important step is hydration of your body adequately with the right type of fluids. You should not hesitate to contact your doctor if you have any alarm symptoms or prolonged diarrhea. Thank you for watching this episode of GI Talk. Stay healthy and happy.